Hello, Dr. James Bogash, expert in health longevity, and today we're going to talk about a topic I've covered a lot in the past, and that is salt restriction, sodium restriction, especially as it relates to blood pressure. Now, I've never been a fan. I've always thought it was not a stupid, but a lazy recommendation based on the low-hanging fruit. So don't look at the rest of the diet, just lower sodium. So you could do low sodium potato chips or low sodium processed soup, and we're all high-fiving each other, patting each other on the back, thinking we're doing something, when in reality, the sodium just has everything to do with the quality of the food that we're eating. So processed foods are generally much higher in sodium, and that's the problem. Blood pressure is almost always a pre-diabetic scenario. So you need to fix the pre-diabetes if you really want to fix the blood pressure. And so that should be obvious, right? Because people with pre-diabetes or diabetes generally have elevated blood pressure. You'd give them metformin and their blood pressure would miraculously come down. It doesn't, or you'd give them amlodipine or something else for blood pressure and their prediabetes would get better. It doesn't, because you're not fixing the problem. You're only medicating that marker. So the thing to understand with salt, so not only is it avoiding the crappy stuff in your diet, but even just replacing salt with things like potassium or magnesium is going to have some good outcomes. So in this study, they looked at the outcomes of salt substitution. And don't mistake salt substitution for a low sodium diet. Salt substitution is more about adding in more potassium, which is going to have some positive benefits, right? So if we see some positive benefits, it may be purely from the potassium and has nothing to do with the sodium. So in this study, they looked at the average of across 16 randomized control trials. Basically, these were out of Asia, so China and Taiwan, followed for at least 6 months, and they found that the use of salt substitution led to a 12% lower all-cause mortality. That's pretty good. Again, thinking that this may have more to do with the potassium and less to do with avoiding sodium. 17% less reduction in cardiac mortality, again, good thing. 15% reduction in MACE, major adverse cardiovascular events. So think heart attack, stroke, those kind of things. And again, pretty decent. But the conclusions were the other thing they found is that there was some uncertainty as far as adverse events. Well, you're not really going to have a whole lot with potassium supplementation, so kind of a non-issue there. The bottom line is that we need to reduce our intake of processed foods that are generally high in sodium. We spice our foods a lot, but if those spices happen to have sodium as part of them, that's fine. But generally, we're looking at there's all kinds of things that you can make your foods that you eat way more lively, way more protective, because spices usually pack quite a wallop when it comes to being protective. So if your doctor just recommends salt restriction for your blood pressure and you think it's going to be wonderful and that's all you're going to need to do, that could not be further from the truth. Sodium restriction is the low-hanging fruit. It's that thing that everybody can do. It's not hard to do, and we can pat ourselves in the back and make us feel like we're actually doing something instead of making real changes that will bring down blood pressure. So as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.